Welcome to True Health Tuesday, and the truth will set you free. Now, let's get into this. This is eye health and chiropractic care. So when you look at the big four, and these are the main conditions that are affecting people: macular degeneration, diabetic retinopathy, glaucoma, and cataracts. And now other common eye problems: macular degeneration or vision loss or deterioration, dry eyes, floaters, astigmatism. Like and subscribe this video. It'll help our channel grow. And please share this life-saving, vital information. Now, the leading cause of severe vision loss in people over 60 is macular degeneration or age-related. And this is when the portion of the macula, starts to break down, and it severely negatively affects it. Now, what causes this, or diabetic retinopathy as well, high blood sugar levels, because this actually thickens the blood, and so that retina cannot get its healthy blood supply, and it's living tissue, so it needs good blood supply. Now, this can also cause the blood vessels to break, which again can negatively affect the vision. Glaucoma develops when the optic nerve becomes damaged and increased pressure in the eye. And this damage to the optic nerve can be high pressure, and glaucoma, if it's there, that pressure can cause a permanent loss of vision. And just no mild visual changes means that there is some kind of problem. Now, cataracts, and this is a clouding of the lens. And it's most common vision loss in people over 40. Principal cause of blindness in the world. And now most cases of cataracts worldwide, there are more cases of cataracts than there are glaucoma, macular degeneration, diabetic retinopathy combined. So cataracts are extremely common. So what's the first step to correcting the vision issue? Let's look at the three stressors: physical stress, chemical stress, and emotional stress. This thickens up the blood. It causes your body to not produce healthy cells. Now, the first things is you have to avoid a topic that we can't talk about. We can call them wacky scenes. Medications can negatively affect vision. Environmental toxins, non-organic or GMO foods, nutrition deficiencies, and chronic stress. The questions that when you're confronted with vision loss, questions, the three vital ones: what are you toxic with? What are you deficient in? And why do you have these symptoms? And when you ask those questions, then your body can go after the solution, because there is a cause. Now, let's look at the 5 keys to health. Proper nerve supply. Number 1, when you look at the muscles of the eye, and right now we're seeing a big rise in this because these muscles are designed to move the eye. Now, when the eye moves, you're increasing and decreasing the pressure of the eye. But too much now, our eyes are just staring at a computer screen. They're not moving a whole bunch. This is why we recommend exercises to increase and decrease the pressure of the eye. So one of the greatest exercises is to keep your head straight. Picture a giant clock in front of you and force your eyes up to 12 o'clock, and then force them down to 6 o'clock, and then up to 1 o'clock, holding it for 2 to 3 seconds, forcing it, then down to 7 o'clock, 2 to 3 seconds, and then 2 o'clock, and then 8 o'clock. So you're increasing and decreasing the pressure of the eye. Now, the optic nerve literally is at the base of the brain. So if you have any structural deviations, this can alter those structures on the bottom half of the brain. Now, there's the oculomotor nerve, and that's the one that does move the eyes. And this is the optic nerve. This is what you see with. And what's wild is the optic chiasm, because when you look at the eyeball, the medial aspect of the eye works on the opposite side of the skull. So the eyeball itself, the lateral aspect of the eye, it is governed by the side of the hemisphere that it's on. So the left lateral aspect is going to function with the left hemisphere. The medial aspect is going to function the right hemisphere. And these two things, it's called a chiasm, or crossing. They cross right where the pituitary is. So this is also Pituitary tumors can also negatively affect vision. Now, good posture, better vision. The eyes are innervated by this. Now, it's the only cranial nerve that's part of the central nervous system along with the brain and spinal cord. Now, this connection to the central nervous system means that two issues. If there's an obstruction of the cerebral spinal fluid, and that's the fluid that the brain gets its nutrients from, and that fluid's produced in the brain, and it's supposed to flow through this large opening called foramen magnum and give nutrients to the spinal cord. So if there's a structural deviation, intracranial pressure can result. And dysautonomia. This has to do with a dysfunction of the autonomic nervous system. And that could be a structural one. Now, there's a number of different chiropractic studies and articles show that the adjustments can actually help vision. Here's one. Cervical manipulation that leads to visual improvement because of visual disorders have long been reported in conjunction with degenerative changes to the cervical spine. And that's because if you have an alteration in structure, that cerebral spinal fluid cannot drain, and that can result in an increased intracranial pressure. Here's a great study. Patient was 20-year-old female with optic neuritis of the right eye. Diagnosed by her general practitioner, reported that she had gone blind in her right eye 11 days earlier and was markedly frightened, obviously. She stated that everyone's face had suddenly gone blank to her one morning. 3 months preceding the vision loss, the patient was in an automobile accident. Very, very common. Now, during this patient's initial exam, she could only detect outlines of large objects and specific colors with her right eye when her left eye was covered. She could not detect the presence of the Snellen chart on the wall. Almost every angle of her gaze exhibited disorganization in the movement of the two eyes. And now, after each cranial correction, eye movements were retested and less saccadic motion and ocular confusion were noted. The cranial corrections were continued at the initial office visit until her eyes were moving throughout the cardinal fields of gaze smoothly and equally. And we check this on every patient. When we're doing cervical adjustments, when we're doing assessment, we rapidly change the patient's position, and we would look for eye movements. And this also equates to good brain function. Now, here's another one. At the end of the first treatment, the patient noted that she could see the author's face through her right eye as well as her mother's face, who was sitting about 10 feet away. And then she was taken to a Snellen chart, which she was able to read 20/30 vision in her right eye. Second visit 2 days later, 20/20. And this was, when you're looking, symptomatic Arnold-Chiari malformation and cranial nerve dysfunction. And this is out of the JMPT, or Journal of Manipulative and Physiologic Therapeutics. Because when you're restoring that curve, you're allowing the cerebral spinal fluid to drain. Here's another case study. Elderly man reported complete loss of vision following a head trauma. Patient underwent post-surgical correct vision acuity along with cataract removal and intraocular lens implantation. Patient's head trauma caused after falling between two logs and hitting both sides of his head. He immediately experienced pain and dizziness. The following day, he awoke. He had lost all his vision. The optometrist diagnosis indicated mild macular degeneration and bilateral slight optic atrophy. And the client was unable to respond to traditional vision test. He was referred to a chiropractor. Now, following the chiropractic treatment, the patient reported that vision improvement began following his third chiropractic adjustment. Patient reported he began to read better, stating at first that his vision improved, seeing shades of gray instead of just black. And then following several additional adjustments, there was an additional blue swirling circles and yellow areas in the field of following gray. And this has to do with the cells in the eye. You've got rods and cones. When you're in low light or low sensory input, your eye switches literally to black and white. When more light is coming in, okay, then you can start to see colors. I mean, brilliant system. And this was out of the Journal of Behavioral Optometry. By eliminating the innervational intervention caused by the cervical soft tissue trauma to the head, the optic nerve blood supply could have returned to normal after its previous constriction caused by the head trauma. I mean, just brilliant. Here's one population studied represented 67 subjects who had not previously experienced chiropractic care. They ranged from 9 to 79 years old, averaging around 46 years old. And they were evaluated for each eye before and 6 weeks after receiving chiropractic care relative to their ability to accurately identify the letters in the Snellen chart. And again, this is out of the Journal of Vertebral Subluxation Research. The study suggests that upper cervical specific C1 and C2, very top two bones, that the acuity of both eyes as measured as the percentage changed in vision acuity before and 6 weeks after chiropractic care. Vision acuity improvements appear to be linked to the correction of the vertebral subluxation and chiropractic methods of the upper cervical specific care. This is why we check everybody's upper cervical. God, those two bones surround part of the brainstem. And if they're off, that cerebral spinal fluid cannot drain. Now, the journal article makes it important to note that through chiropractic is not a treatment for esophoria, blindness, or scotoma. The correction of vertebral subluxations provide patients with benefits such as visual improvements that are not directly linked with their musculoskeletal complaints. This is why I never ask people, how are you feeling? It's like, how are you sleeping? What's your biomechanics like? Are you getting 2 to 3 healthy bowel movements a day? What are your sleep patterns like? That's important. Here's another one out of the Journal of Traditional Chinese Medicine. In 114 cases, visual improvement was noted in 83% of the cases. Out of 54 of the cases that researchers followed up for a minimum of 6 months, 95% of the population illustrated a stable therapeutic effect. Also contained within this report were cases of vision being returned to blind eyes. Now, if you look at this, the journal article briefly discusses that the spinal nerves play an important role in vision. The nerves from the cervical spine and upper thoracic spine, so it's not necessarily in the cervical spine, help dilate and widen the pupil. When those pupils dilate or open up, they actually let more light in the system. And that dilation has to do with the sympathetic nervous system located in the thoracic spine. Now, these spinal nerves also make distance vision possible by helping change the shape of the lens while also controlling the blood vessels that supply the brain and eyes. Chiropractic treatments often focus on correcting misalignment or fixations, we call them subluxations, in the upper thoracic and cervical spine, which can disturb the same spine nerves that affect vision. Again, out of the Journal of Vertebral Subluxation Research, chiropractic adjustments to correct subluxations can help alleviate the related visual disturbances. Read, quote, reported that even some people with 20/20 vision at their first visit have better than 20/20 vision after 2 weeks of chiropractic care. Why? You're correcting the problem. This is why we talk about the 5 keys of health. Chiropractic focuses in on the proper nerve supply because you live your life through the nervous system. You also have to do the regular exercise, proper nutrition, sufficient rest, prayer and meditation. But just know that if you are looking at vision, you have to look at the nerves and the nervous system because the body has 2 switches. You could be in a stress state or a regenerative state. And when you're in a stress state, your body cannot function well. Now, please post your comments down below. We'll get to as many of the questions as we can. But God bless you. You've got to take care of your nervous system because your nervous system controls every function of the body. And look at all symptoms, whether it's vision, digestion, anything. Look at those as fire alarms to a dysfunctional system, to a system under stress, a system that's adapting as best as it can. Stay healthy, my friends. God bless you all.